So let's start with eating disorders. Okay. So we have bulimia nervosa, anorexia nervosa, and binge eating. First, we'll see bulimia nervosa. Bulimia nervosa is an eating disorder characterized by recurrent episodes of binge eating followed by inappropriate compensatory behavior. मतलब पहले दबा के खा लेंगे, फिर सोचेंगे अरे ज़्यादा हुआ और फिर उसको निकालने की कोशिश करेंगे. So what is the etiology or risk factors? Genetic predisposition. Then disturbed body image. Okay, this is disturbed body image and low self-esteem. Sociocultural pressure for thinners, those people who have very thin body. Then psychological stress, perfectionistic traits. Okay, perfectionistic traits. Then comorbid depression and anxiety disorder. So these are the etiology or risk factors. Means again I'll repeat: genetic predisposition, disturbed body image, low self-esteem, sociocultural pressure for thinners, that you are very thin, psychological stress, perfectionist traits, comorbid depression and anxiety disorders. So these are the etiology or risk factors for bulimia nervosa. Coming to the clinical feature of bulimia nervosa, binge eating. Okay, binge eating means eating large amount of food in a short time and sense of loss of control during binge eating. So this first they will eat. Okay, then they'll have some compensatory mechanism, that to inappropriate behavior. Okay, like self-induced vomiting or finger-induced vomiting. Okay, then they can use laxatives or diuretic abuse also. They can go for fasting and excessive exercise. Okay, so first they will eat a lot and after that they'll do all these things. Coming to psychological feature, they will have retching. What is retching? It is characteristic of psychological vomiting. Okay, then they have intense fear of weight gain, body image distortion, guilt and shame after being binge episode. Sorry. So after eating so much, they'll have some they'll have some guilt and shame. So these are the physiological features. Coming to physical features, their BMI will be normal. There can be parotid gland enlargement. There can be dental enamel erosions. Okay. We can see calluses. We can see calluses on knuckles. We can see calluses or rash pigmentation due to finger-induced vomiting. Due to finger-induced vomiting, we can say this. Okay, this is rash pigmentation. That is called Russell sign. That is known as Russell sign. So this is the physical features that we see, and others will have other features are Mallory-Weiss syndrome or Mallory-Weiss tears. Okay, these are the mucosal tears in lower esophagus due to significant pressure changes during vomiting. Okay, vomiting करते समय pressure change होगा and there will be some tears in the lower esophagus. So these are the physical features. Complications are electrolyte imbalance and dehydration. Okay, so this was in short about the bulimia nervosa. Means first they will eat and after that they'll do inappropriate behavior and feel guilt and shame for that. Then other features are esophagitis or other complications are esophagitis, gastric rupture, cardiac arrhythmias, depression and suicidal risk. Coming to management, we have to write again pharmacotherapy. Okay, pharmacotherapy will write fluoxetine. We'll write fluoxetine, that is an SSRI. Okay, and this is the drug of choice and this is FDA approved also. Okay, then we have to write psychotherapy. Psychotherapy we have to go for CBT. I have told you CBT, that is cognitive behavioral therapy, that is the mainstay. Then we have supportive care, that is nutritional counseling. Then treat medical complication and then family involvement. So this is the supportive care. So this was about the bulimia nervosa. Now we'll see anorexia nervosa. This is the most dangerous eating disorder and is seen in 10% of the patients. Okay, and this eating disorder is characterized by persistent restriction of food intake leading to significant low body weight. Okay, they'll not eat only. And why they'll not eat? Because they have intense fear of gaining weight, moti ho jaungi, and characterized by distorted body image, feeling of being fatter despite being underweight. Okay, already they are underweight, but they are not eating because of intense fear of gaining weight. Okay, so this is about the anorexia nervosa definition. Etiology is same as bulimia nervosa. What are the clinical features? The psychological clinical features is fear of weight gain, body image distortion, then denial of seriousness of low weight. So these are the psychological clinical feature. Coming to the eating behavior, severe dietary restriction, avoidance of high calorie foods, and excessive exercise. Coming to physical signs, marked weight loss, emaciation. Then in females, amenorrhea can be seen because of excessive weight loss, dry skin, cold intolerance, bradycardia, hypotension, and lanuitis. So till now we have seen the definition of anorexia nervosa, etiology, clinical features that we have divided into psychological clinical feature, eating behavior, and physical signs. Now we'll see the diagnosis and treatment of anorexia nervosa. Diagnosis in adults is done if BMI is less than 18.5 kilogram per meter square or loss of 15% of ideal body weight. If these two things are there, or if any one of these two are there, we'll diagnose it as anorexia nervosa. In children, less than 5 percentile of BMI. Okay. Now coming to the complication of anorexia nervosa, electrolyte imbalance, cardiac arrhythmia, osteoporosis, infertility, and growth restriction in adolescent. Management. In pharmacotherapy, you can again write small doses of SSRI or olanzapine, but it is just tried. Okay. Then we have nutritional rehabilitation, that is gradual weight restoration. Psychotherapy means again cognitive behavioral therapy and family based therapy. Okay, there is no FDA approved drug till now. Keep in mind that there should be gradual weight restoration. Okay, and while doing this restoration we have to monitor the electrolytes, otherwise they may cause refeeding syndrome. Okay, what is that? Refeeding syndrome. This is a complication during treatment. Okay, so overcompensation by giving lots of calories, that can cause increased insulin. So I'll explain it what happens. Since already they were eating very less. Okay, so the insulin was not being used too much. Okay, now they have started, while on treatment they have started giving so much of calorie, so the insulin will increase abruptly, and as insulin will increase abruptly, there will be hypophosphatemia, hypomagnesemia, and hypokalemia, and that may cause arrhythmia, seizures, coma, and death. May lead to death also. So this is refeeding syndrome. It is very dangerous. Okay, so we have to keep in mind about this. Okay, so this was about the anorexia nervosa and bulimia nervosa. Thank you so much.